Welcome to the Preparedness Partners webinar series hosted by Logista. Our topic today is what's next for the SNS. My name is Ethan Downing. I'm one of the co-founders of Logista. I'm here with Drew Downing, the other co-founder of Logista, and our moderator for today. Drew, I'll kick it over to you to say a little bit about the series and what we're looking at today.
Yeah, we're always trying to get people talk on something big idea or something relevant to our field, emergency management and public health. And I've gotten a lot of emails and inquiries from folks. I think I've talked to certainly over half the people on this webinar, and a lot of those conversations is our current landscape, right? And there's things we don't know. There's some things we do know, like things are going to change. How they're going to change, when they're going to change, what they're going to look like, we don't totally know. And I think that includes even the decision makers who are making some of these changes and are the conduits for that change are trying to navigate it as well. One of the big things has been the SNS, and something that we've kind of planned around, built around, trained, exercised around, and it's changing. And I don't know personally how it's going to play out, but I think we need to bring in some people who have other perspectives, other conversations, know more than myself, and hopefully can shed some light on what they're hearing, and more importantly, too, what the reaction we need to do, right? From a state perspective, from a local perspective, I think it's real easy to get caught in what's happening next when we don't control any of that. But what we do control is that area right around us. So I want to introduce our speakers today. We have Gabby Hurtado, who's up in Washington State. She is a BioWatch jurisdictional coordinator with 12 years experience. Before that, doing MCM at the City of Long Beach Public Health Department. So if you know MCMs, you probably come across Gabby. So she did a lot of planning in a very complex area of Southern California, working with local health departments, EMAs, and all that. So I really, really respect Gabby. I really value her perspective as MCMs, and one of the people I think of when I think of MCMs. And then helping provide some of the state perspective and beyond, Peter Coons from the Tennessee Department of Health. He's MCM coordinator there, and he's helped through COVID response, other complex response, helps on other things too, and the MS. So, today they're not representing the BioWatch program or the Tennessee Department of Health. They're sharing their perspective, their lens, conversations they've had, and hopefully stuff that will help us just be able to react, take into consideration at our local and state levels. Ethan, I'll be on here too to help maybe funnel in some questions. So if you got them, put them in the chat. We already funneled some through the emails that some of y'all replied to me, so I appreciate that. So what I want to do, we have 55 minutes, recap maybe the current SNS status of what we know. And I know that's changing, but what we know as of now and what we've heard. Maybe talk about impacts for jurisdictions. So what's that trickle down effect? And then what can we do? What's in our control? What's in that span of control for us, the actions that we can take now and take into consideration. And then we'll hopefully have some time for questions. Gabby, I'll let you maybe kick it off from here, and thanks for joining.
Thank you, Ethan and Drew. And actually, I am going to have Peter kick us off, kind of sharing, like you guys said, why we're here, what we're discussing, and then we'll go into some state considerations and state perspective.
Sounds good.
All right, so I get to start. So one of the main conversations that we've been having on the MCM side of things is we were informed by the Strategic National Stockpile that essentially they have been asked or told by those above them that what they need to do is kind of return back to their core mission, right? Is not to be our shopping cart, but to be truly what they are, right? Is just that they're the emergencies. One of the things they've done to that is they have decided to go ahead and take away the 12-hour push package, which I think a lot of us understand that it was an asset that wasn't really utilized a whole lot. with the ability to do direct shipments and the ability to, sorry, there he goes. My camera went out. There we go. The ability to do direct shipments and the ability to go ahead and deliver things to where we need them, not to where we might need them, rather than just giving us this shotgun approach of giving us everything we might need. It's what do you actually need? And so it going away, not a big deal. Federal medical stations, they're saying they haven't deployed them in a long time, but it's still an asset that has been used in the past. And it's kind of like a shock. Um, then they came and they started talking about this concept of local stock or jurisdictional stockpiling, as they're calling it, which they put out these 2 listening sessions. They wanted to know where we as jurisdictions stood with stockpiles, what we would do to plan in the future, and what we would do if the SNS basically, I hesitate to use the words going away, but if the SNS as we knew it went away, if the SNS is this large scale Walmart of come to us with whatever you need went away and they returned to their core mission. Um, that started a lot of these conversations. I think some places handled it well. Their listening sessions were very interesting. If folks on the call were on them, they got pretty hammered by jurisdictions basically saying, "Hey, you're changing everything that we've done, everything that we planned. How are you going to help us?" So that's, I think, where we're sort of coming from now at this point is, okay, we know these changes are coming. What are we going to do to try to mitigate these these impacts on us as a jurisdiction? Is that a good enough recap of why we are where we are?
Yeah. No, that's helpful. Like, and exactly what I was saying earlier, because changes are coming. What they are, don't know exactly, but we have a definite feel for the direction, and that pulls a little more. That's a little more concrete footing for us.
So from the state perspective, right? We talked about that we've been informed that these changes are coming. We don't know exactly what it's going to look like. So we're in that mode of how do we determine what to stockpile? A lot of folks have gone back to the SNS and said, "Hey, you need to tell us what to stockpile." And I think not incorrectly, the SNS has basically turned it back around and said, "You need to decide what you need to stockpile. You guys are required to do whether you want to call it a JRA, a SVA, a THIRA, a whatever you want to call it. You're required to do some kind of a risk assessment. You know what you are concerned about. So you need to figure out what you need to stockpile for that." And because every jurisdiction is going to be different, right? And every jurisdiction is going to be different depending on the size of the jurisdiction, the nature of the jurisdiction, what they've got going on. If you like your Gabby was before, you have a large port. We don't have a large port. We have one small port in Mississippi or on the Mississippi Delta right there in Memphis. But what I need from a port isn't the same thing as the city of Long Beach needs. So do your own risk analysis, figure out what you're going to need to stockpile. And then turning to the healthcare side of things, that starts to get a little bit trickier, right? Because then you get into things like how are we going to rotate stock if we stockpile items? And if a lot of us sat on H5N1 leftover medical countermeasures of gloves and gowns and things like that literally sat in our warehouse and rotted. Um, if we were going to be helping the healthcare folks, how are we going to do that? How are we going to get the coalitions to be more involved as partners in this? How can we make sure that if we buy gloves to stockpile, that they're constantly being rotated through? And right now, every jurisdiction is different, right? There are jurisdictions out there that have legislatively mandated stockpiles. There are states that have legislatively mandated, take a look and figure out what you need to stockpile. And then there are other jurisdictions that don't have any requirements. And those are the ones that I think are going to have the larger difficulty because those are the ones that are really going to have to kind of start from scratch unless they were doing this during COVID. So I think every jurisdiction has got a big road to hoe with first off, even deciding what they need to stockpile, let alone figuring out where the money's going to come from.
That's where my mind went when you brought that up. Whether it's your experience, how y'all did it, or do you have? It's almost an overwhelming risk analysis and knowing where to draw those lines, right? You're doing your best to say, this is our population, these are our critical infrastructure, these are all the factors, these are the stuff and things that will need to support that in a disaster. But what's the criteria you think for for how long and how quickly? And because right, it's an allocation of scarce resources, and where do you draw those lines? Did you have criteria that helped y'all do that?
For us, not so much. There are certain events that we need to have. Like we know for an Ebola response, we know we need to have this amount of PPE for this long of a period of time, basically before we can get rid of the folks and send them to a higher level of acuity.
Mhm.
But as for a statewide response, we're an odd state, right? We're a very short state, but a very long state. We break our state up into three grand divisions when we talk about Tennessee, and then we break it down further. But the geography is different. The
Mhm.
threats and hazards are completely different all across the states. So for us, I don't know that one big stockpile of everything makes sense. We would have to do something. One of the strangest things with these learning sessions with the SNS was, they wanted to talk to us about jurisdictional stockpiles, and we spent a good portion of the two calls describing and defining what a jurisdiction was and what a stockpile was. And it really depends on what you need for your areas. We are required to do threat analysis and threat hazard analysis. Our EM does one. We do them on the public health side. We have our hospitals do one on the healthcare preparedness side. So we have a lot of information on what people think are are their biggest threats. The hardest part is then collating that data and trying to figure out where's the commonality, where can we overlap, who can maybe help try to be responsible for some of that. Um, but in the end, it ends up coming down to the dollar, right? We're in a period of time where budgets are being cut, people are being let go, and then to turn around and then suddenly have a large burden that we don't have the funds for, we have to then turn around and go to the state, and that's battle. It's we have to go to our legislature and argue why we need extra money when in the past we haven't asked for this money. So what we are trying to do in our state is just really show what benefits public health has, how we respond, the things that we respond to, um, and just basically we're going hat in hand. In terms of how long we need stuff for, it kind of depends on the nature of the incident, right? I mean, if it's a tornado, it's a relatively short-lived process as we move through the recovery of that. Flooding takes a little bit longer. Heaven forbid, I'm knocking on everything wood in my office. If New Madrid were to go, nobody's gonna have enough stuff for anything. So
Yeah.
we're just trying to do the best that we can. Hospitals have their own requirements. So it's a juggling act, and I don't know that there's any one right answer. Maybe smaller jurisdictions can get away with a really defined set. I think it's a more difficult with states that have larger geography, especially that have disparate geography across the state. So,
Yeah.
and we don't have a mandate, right? And some states are doing 3 months worth of PPE, 9 months, 6 months, and I think until they get to the point of actually having to stockpile this stuff, I think, and they see what the quantities and the volumes look like and get into some kind of rotation program. I don't know that anyone knows what the right answer is.
Yeah, I hear you. That's a really good way to put it. And you mentioned hospitals have their own mandates and requirements and CEOs, and you're balancing partner jurisdictionals. I'm always just so curious if there's folks doing. Sometimes the thyroids drive me a little wild because I'm yet to really see one that has a lot of great data going in science, and it's more of a jockeying and well, this is how this is this, and we rank this. And when you dive into it, I'm like, where's the data to get there? Because that could really inform some of the risk and hazards. And they're tough conversations, but thank you.
Okay. So I just wanted to touch base on some local considerations for my MCM and FET planners out there. Um, and this is nothing new. This is a lot of stuff that was discussed on the SNS listening hours. But I would, I have to mention that there are benefits to having a jurisdictional stockpile. Um, when there's a supply chain shortage, as we've seen in the last few years of things being added to the short list, obviously response operations to provide pro-feed to your first responders, which for all of us in FEP, we know that that falls under FEP capability 14. However, as P and all of us know, the biggest consideration is the cost. Stockpiling can be expensive, and it's not just in the cost of actual purchase, but there's also cost in storage. Where are you going to store them? Is it temperature controlled depending on what you're storing? The staff that might be needed to inventory, monitor these MCMs, and also there's the cost of destruction, right? We, I think, heard this a lot on the SNS listening hours about the shelf life extension program. And this was something that during my time with the NATO MCM work group, we tried discussing a lot with our partners over at SNS. If we are going to ask folks to purchase their own MCMs, is there a way that the federal government and the manufacturers could support us in having some sort of schlep program for these local inventories? But again, I don't speak for any of the feds, so that's something I think that would have to be discussed further with them as a consideration. And then, of course, like Pete mentioned, is just being extremely clear on how the items in the stockpile will be counted. Is it going to be by unit? Is it going to be box, cases? I saw a couple of questions in here about like regional stockpiles or sort of knowing what other jurisdictions have. I did just want to mention quickly that there were a few jurisdictions, and during my time with the city of Long Beach, I was very fortunate to work with California Department of Health, Washington Department of Health, NACHO, ASTO, and ASPR HCORE, specifically around data elements for inventory. So again, if we're going to be looking at something like regional stockpiles, aside from sharing the costs, maybe the space, but also looking at data use agreements in your MOUs, MOAs. So then that way you're clear on how everyone is naming these items that are in the inventory. And again, if you say it's a mask, what kind of mask is it? If it's PPE, what do you consider PPE? So those are, I think, conversations that need to be had as well. When looking at the guidance that we are sort of seeking from the federal government in terms of jurisdictional stockpiling. And again, a consideration for the local planners, the state planners is, if you're going to have some sort of naming convention for all of your inventory to, again, just sort of help in clarity and transparency. If there is a need to ask your neighboring jurisdiction for something, or if you're considering doing a regional stockpile. And I don't know, P, if you have anything else you wanted to add to this one, but if not, we can go on to the next one.
Not really. I mean, I think it is important, really. One of the most important things on there is the data elements, right? I mean, you and I were both parts of essentially the same group, one with Nature and one with ASTO, working with the HCORE folks to try to talk about how we would communicate inventory levels and things like that. And finally coming up with standardized data elements was one of the trickiest parts of the whole process. We were able to do it eventually, but we started, I think the initial run was something like 33 data elements, and we got it down to 12. And even that was it was a massive achievement. And even that may or may not include everything, but it's a great start, because we all have to be speaking the same language with this stuff. And until we do, it's just the Wild West.
Pete, Gabby, did you have any success stories of the data alignment during COVID or naming or anything like that?
I think COVID was, yeah, I mean, so I think that's something that we saw as well during COVID. If we referred to an item a certain way, maybe someone else didn't. But then, of course, when we're looking at all of the reporting that we were required to do, either through HPOP or through Excel spreadsheets or emails or however we were reporting on our inventory, that was very clear on what they were asking for, in my opinion. But before sort of the climate shift that we've seen, I think the goal of the project with HCore was to have, like Pete said, these standardized data elements that we could use. There was hope that there would be another iteration of this project. I think the last I heard, there was no funding to continue that project. But within the state of California, very well received. I mean, I can't speak highly enough of California. The Department of Health is amazing, and how they run their inventory, their resource requesting, all of that is just phenomenal. And so it was not difficult to be in alignment with them. And so at the end of that project, Long Beach, since I'm no longer with Long Beach, but Long Beach was able to get a data use agreement with ASPR HCore. And then one of the other things too that we gave feedback to HCore was, it's great to have these standardized data elements, but SNS actually needs to be part of these conversations, since they are the ones that are actually doing the shipping. Of course, gathering the data is very essential in these operations, but of course, making sure that the folks in the actual warehouse are, aware of what's going on, is very important as well.
Pete, from like your standpoint during COVID, would that have, like, if it was very standardized from your locals and within your state, would that have like made life significantly easier? How much does that move the needle? I'm just
I
curious.
think I think it depends, right? Because we really saw two different issues. One issue was even internally, right? We would have a health department say, "Hey, we need N95s." Well, it turns out that they were all fit tested for a very specific model, and they didn't want to use any other model, but they just said
Mhm.
they needed N95s. Well, we were only able to get duckbill N95s, not the N95s that they wanted, but these ones, and you know but we just ordered N95s because that was all we could order. So we sort of saw a little bit of the opposite, right? We saw even internally the confusion, and then going externally, and then it became a matter of we could only get what we could get. Um, and if you didn't like it, it was too bad. We were lucky to get it. But then when we would have to turn around and start giving the data back to the feds, when they started asking us, in the Operation Watchtower, right? They wanted to know how much stuff was in all the states. It's like we really fought internally to try to codify things, and it never seemed like we got in the right space. And I think the program that HCore was trying to do with this data use agreement thing and getting the common elements is a step in the right direction, because it's going to be necessary for us all to be ordering the same thing, receiving the same thing, reporting on the same thing. Um, and it's still gonna have unfortunately, still gonna have a lot of manual process in the entire program, because there's no simple way of, if you're only gonna send me 1,000 vials of something and I only need 50 of them to go to different locations, we're already starting to talk a slightly
Yeah.
different terms. So there's a little bit of that, but I think for us, COVID was a bit of an eye opener on the need for commonality.
Mhm.
Hey,
So
Peter,
is it-
yeah,
Go
uh,
ahead.
wanted to just kind of tug on this thread a little bit on this H4 Nature ASTO data project that you guys are both involved with. And it sounds like you were able to figure out what stuff needed to be tracked. You're able to sort of uh, uh, narrow down, right, what those items were. Was it also then that you guys put in an ad hoc naming convention so that the data could kind of match? Was it that the types of things that you decided would be tracked was tracked? Can you talk a little bit kind of about those outcomes, a little more on the realizations, lessons learned? And Debbie, you hit on this a little bit of, the follow up. The intention was kind of more, but where did it leave, and what was sort of the um where did everybody sort of end up on that path, that journey of realizing data is important, and these are the next steps that we really need to do? Because I see a lot of fractured data across all counties when we talk
Yeah.
about.
Yeah, and I will just really quickly add, we had the opportunity to meet the then ASPR, Don O'Connell. I completely had a fangirl moment. It was amazing. But Don O'Connell was very transparent in how that project started. And it started back in MPOX when she was in a press conference and was asked, of the doses of the vaccine that were shipped, how many were used? And she didn't know the answer. And so that's where this project came about, is that they were shipping stuff but then didn't have visibility into what was utilized from what was shipped out of SNS. um, and then in terms of like where the project ended, I so the whole goal of the project, again, aside from having these sort of agreed upon data elements, it was also to have a signed data use agreement between the jurisdiction and ASPR HCore. And so, like I mentioned, Long Beach was one of those. The wonderful state of Washington, Washington's inventory system is very similar to California's. It's amazing as well. And so they also, I think they were one of the first that had their data use agreement signed. And I think some of the other jurisdictions did as well. But unfortunately, because of, again, sort of this shift we've seen in the climate, there wasn't any funding, last I heard, to continue this project. But the other thing too that was important about this project was it wasn't the feds telling the locals or the jurisdictions that they had to use a specific system. It was through open API. So basically visibility, um, whatever inventory management system, let's say state of Washington was using, didn't have to be the same one that ASPR was using. It was just through this data use agreement that on these agreed upon elements that ASPR would have visibility into their data system, and then Washington, obviously, sharing with ASPR. And then, there was also some discussion of, what if there's an incident? Will the so it's basically like through the open API, it like refreshes, right, every X amount of time. And so if there's an incident, increasing that so that it shares maybe every half hour, every hour, depending on what the ask was. But it was a really great project. And again, as we're talking about having jurisdictional stockpiles, I think it's something that our planners at the local levels really need to consider, again, when they're looking at what they want to stockpile, how, whether it's on their own, it's a shared space and cost with a region. um, just having some agreed upon elements, and obviously working with your state too. If the state already has any standardized elements, I think that would make this whole lift a little bit easier on the locals.
Fantastic. Thanks, Gabby. That was awesome.
Yeah, I would agree because we did essentially once we realized that a lot of the sharing of data was really more internal, from our central office to our local health departments to potentially our hospitals and stuff like that. That was really kind of where we ended up focusing. And then we were in this last cohort, so unfortunately, we saw essentially the dismantling of HCore. We saw last week or the beginning of this week the notification that HPOP is going away. So we basically saw kind of everything that we had been working with slowly start to fall apart, without any real knowledge of where, we're going to be ending up using Tiberius again as the ordering system, supposedly. Um, Thankfully, I guess we hadn't spent any real time getting APIs working with HPOP because right around the time that we were there, we were notified that they were no longer doing anything technical. So we kind of saw it unfortunately fall apart, but we continued to use it as a mechanism for us in the state to communicate amongst ourselves, at least, to be able to get the state and the locals to communicate what they have, how they're using it. How many, they got this many items, how many items do they have left? So we have that capability. So whatever the future state looks like, we think we're ready to step into, oh, okay, well, just let us see what the APIs from Tiberius look like, and we will incorporate those. So unfortunately, to Gabby's point, I mean, the program just sort of withered away, but the work was still done, and we saw a lot of really great work from the other jurisdictions that were involved. The old adage of you've seen one jurisdiction, you've seen one jurisdiction, you've seen one health department is true. It's amazing the different levels that everyone was doing. Some states super, super robust, other states essentially, a web shopping cart and an Amazon back end kind of a thing. But whatever works. And if we can communicate that data internally, we can figure out how to communicate it externally.
Okay, so I saw a couple of questions in the chat about, we've talked a lot about what SNS isn't doing anymore, what they're moving away from, and what are they actually going to be doing. Um, Fair question. But if you haven't seen the SNS, I did want to just highlight this because it is, a resource to the planners. But they put out this letter. I know it's so small you can't even read it, but they put out this letter on August 20th. And it's the SNS Planning Resource and Operations, or the Pro Guide. Excuse me. Which, if you're familiar with version 11, it builds on version 11. And, they say that this guide reflects on the evolving threat landscape that, we're seeing today. And they did release some web-based modules, which actually they released one just a few minutes before this webinar started, that is around risk communication and the SNS formulary. And they also have one that's specific about local stockpiling. And they offer some key considerations to keep in mind when you're determining if you need a stockpile. Is it urgent? How urgent? Some partners to consider to, collaborate with when determining the need for your jurisdiction. And then just some other thoughts to help in determining what to stockpile. So I did just want to point that out. And that's sort of what this letter talks about. But then just, again, some other considerations. In the letter that was on one of the other slides, which I know again is very small, but that letter came out in July, which is where they talked about SNS's mission, sort of going back to focusing on the core SNS mission of responding to CBRN threats and pan flu. I think, in continuing conversations with ASPR and SNS, it would be beneficial to understand, because I've seen a few of these questions in the chat. To understand what exactly will be maintained, when they say that they're going to respond to these threats, what what's going to be maintained, and that'll help the local planners in considering, what to purchase. I think it will also be helpful if the feds, as we discussed, can assist in some sort of like shelf life extension program for these locally purchased products. And then funding, of course, we all are very familiar with the restrictions of, if you purchase this with this grant, it can only be used for this. And so I think that's another thing that we would need to talk to the feds a little bit more, um, to allow jurisdictions to actually have their stockpile. And then we saw this a lot during COVID, but donations is a really big thing. And so another thing, at a state level, the local level, is it possible to have a different type of donation program for these locally purchased items that will be stockpiled? Like I mentioned, if you remember during COVID, we were not allowed to donate vaccines, or really anything unless it was at the state level, the federal level. And from my understanding, it was not a very easy task. Um, but those are just some of the things that I think for the planners might help for some of these considerations.
That's super useful, Gabby. Thanks for bringing in breaking SNS guidance. Um, Pete, from like your perspective, what's the biggest like guidance or things that, as this SNS is devolving or whatever the terminology we want to use, what would be helpful guidance you think, like from the seat that you sit in usually?
Well, I just put in the chat, Brian Hartsfeld, who's running is basically sort of running the SNS at this point. Um, on a programmatic level. We have a meeting where we have our regional MCM folks get together, and Brian was on the call, and Brian mentioned something that was kind of interesting, that New York City and Chicago had been working together on some SLEP programs for antibiotics. And they were looking to pull together some best practice guides to kind of help figure out what they've done, what that process looked like. Same thing with the state of Minnesota is looking at some purchase programs, like more like group purchasing, trying to figure out how we can do group purchasing, because those things are going to be what we are going to need as a jurisdiction, right? I mean, we can buy drugs, right? We have a state pharmacist who can buy drugs, but if we can get better pricing somewhere through the assistance of the SNS, that would be very beneficial. The shelf life extension is probably the single largest thing that I think need assistance on, because it's very expensive to buy medication, and it's very expensive to buy medication and have it sit in a warehouse and not get used. And if we don't have some mechanism for rotating that stock, we're in a lot of trouble. We as a state used to have a small stockpile of antibiotics that were sitting in a pharmaceutical warehouse in Kentucky. Unfortunately, that company was bought out. They decided they were no longer going to stockpile. They were no longer going to even manufacture and sell the antibiotics. So once our antibiotics expired, we didn't really have a mechanism in place. So that capability, I think, is going to be probably what they can bring. And that's what I think what they're shooting for, right? They're shooting to be the place that you go to when you need assistance to get something, not necessarily when you need something, but when you need assistance to get it on your own. We've been hearing from the SNS that we can expect questions like, okay, well, what have you already done? How have you tried to solve your shortage problem before you come to us, so that they don't feel like you're just coming to them for everything? And so we need to have a more robust system on our side, but the assistance that they can give us is that buying power, those the contacts to get in there, maybe working with some larger groups to figure out rotation and to figure out shelf life. I think that's going to be the most important things for us, at least.
That makes complete sense. We got some questions, but any closing thoughts before I jump into some Q&A, either from you, Pete, or Gabby?
Well, I think that the biggest question, right, is we don't know what we don't know. And I will caveat that every time I hear from anyone at the SNS, this is the information as of this moment on the call. I mean, there have been a couple of times that I've mentioned things to folks at the SNS, and Brian's gone, I didn't know about that. Oh, the HPOP thing was a perfect one, right? We had gotten the notification that HPOP was going away. I mentioned it to Brian, and Brian went, I hadn't heard that yet. It's like, that's how quickly things are changing. So I think, unfortunately, it's difficult to plan when you don't know what you're planning for and you don't know what your shortfall is. But I think the SNS is kind of treating it like, well, figure that we're not going to be here for anything, and you're better off, knowing that they're going to still stockpile the stuff that we can't, right? We can't buy smallpox vaccine. We can't buy a lot of the CBRNE kind of stuff. They can't. That's the kind of stuff that they'll continue to do and continue to hold on to. But going to them for N95s or going to them for, gloves is not going to happen once they get rid of all of their stuff. So
Yes, that makes complete sense and quick logistical challenge. If you have questions, Gabby or Peter, please pop them in the chat. Essentially, people all looking for guidance on SNS and the ripple down effects. Is there any tips? And again, just pro tips from both of you, steps that you would take at a local seat, in a state seat, to start doing now, the actions that you would prioritize now if you had to start, I don't want to say from scratch, but that you want to start stockpiling, you want to start getting some of this regional stuff in place. What would be the steps or things that you would prioritize now?
I can tell you, for us, it's securing funding. And one of the ways that we do that is we are very large proponents in this state of showing your work. Anytime we have a response, we put together, um, they're referred to as one pagers, but they're essentially just a synopsis of here's an event, here's how we responded, here's what public health did, here's the resources that we brought to the table, here's what we do. And so that, and by now we have a fairly large pile of these things. And these are the things that we can take to our legislature and kind of say, look, here's what we're doing. And you have to understand that as federal funding moves away from this, if you want us to continue to do this, you're going to need to help us on the state side. And part of what that's going to go towards is going to go towards outfitting people to do these responses. So the stockpiling of items, we're not going to be able to rely on the feds much longer. We need to be able to do this ourselves. And the only way we're going to be able to do that is with funding. But if you don't show your work, some states have really great relationships with their legislatures. Some have poor relationships with their legislatures. And you need to be able to, we always talk about if you don't toot your own horn, no one's going to toot it for you. So, keep track of what you're doing, show what you're doing, show the work, and really, really be able to full court press. Because the only other thing that's going to show those folks that you need the money because of what you do is when a disaster happens. I think we sort of saw that with the conversations around FEMA all these conversations about FEMA going away, and then the floods in Texas happened. And everyone kind of went, oh, well, maybe we need to rethink this a little bit and rethink our approach. Yeah, that's great, but let's do that before something happens.
I find, and I don't know what your experiences give you, Peter, with executive leadership, whether it's county or state level, is also sometimes the conversation needs to be put into dollars and amounts and demonstrating how this somehow is saving money in multiple ways and bringing that down multiple stories and bringing that data to it too. So they have something that's highly defensible or somewhat defensible in that monetary lane as well.
We also see, we've been really kind of pushing the SNS to talk to people above us, right? Because we all know this. Talk to the state EMAs, go to the NEMA conference, talk to governors, go to the National Governors Association meeting, talk to these people who are really also going to be impacted by this and let them know the changes that are coming so that they don't assume that things are going to be the same, because for a lot of them, the last big event was COVID and the government just gave us all kinds of stuff. And like, if they don't understand that that's not going to happen, they're not going to be preparing for it on the legislative side. We need a lot of that high level engagement to occur so that the legislatures aren't going, oh, it's just public health asking for more money. No, this is the feds telling you that this is going away. And if you want this kind of stuff, you need to buy it. And I think that's the only way for some states that have, again, a more contentious legislature is to hear this from the people way up on the food chain.
And just really quick, I saw a couple of comments about rural hospitals and rural areas, and then about the healthcare partners. I think as preparedness and response planners, I think it's very important to have these conversations in your healthcare coalitions with your emergency managers, with your first responders, because yeah, somebody asked, are the healthcare partners aware of the SNS changes? I don't know, right? And so I think again, leveraging all of your networks to make sure that they're aware. And again, looking at sort of cost sharing. If you decide to have a stockpile in your jurisdiction, maybe you gear it towards your first responders that would respond in, let's say, an anthrax type of scenario. I think that would be a good conversation starter with your first responder community of, hey, this is really important, so can we share this cost? Or with your healthcare partners, making them aware. And then again, just trying to leverage these different partners and seeing if it's possible to share these costs. I think, again, just as planners, I would urge you to have these conversations with folks if they aren't already aware.
Gabby, Pete, what's the best form for that? And it's almost kind of crazy to say this, but lacking like this reliable through thread that has been parts of the federal government for us to have these conversations and to know, as someone pointed out here, Robin, like which states and their cash and their stockpiles and where they're at and where they want to go. I was talking to a large state in the Northeast 2 weeks ago, and they're very robust and they're planning to make it robust. And she said, and we have conversations offline with each adjoining state that will support them. And they know that and they know how to request. That might look very different than somewhere else in the country. And how do we know? There's 50 states and there's regions within those states. Where's the form? How do you have these conversations?
I think, like I said before, right? You've seen one jurisdiction, you've seen one jurisdiction. Unfortunately, we have been in Tennessee. We've been really trying to make sure that the as we hear about this stuff, that it gets through to our HPP folks, our FEP folks, that everybody who's kind of got a hand in public health hear about it. We're also trying to let the EM folks know that this is happening. We have fairly good relationships with those people. We have a health department person who actually sits in our EM half of the week. So, when he hears something, he's able to let people there know. But that's just how our jurisdiction runs. There are a lot of jurisdictions that, the public health is completely separated between the two funding streams, and then let alone all the downstream public health stuff. Some jurisdictions, FEP and HPP don't talk to each other. And, when that's the two main groups that are going to potentially be impacted by this, that could be dangerous. So it just, you're right. I don't know. I don't know what the answer is other than it needs to happen. And that's again why we're so adamant that the feds need to take somewhat of an active role in ensuring that the high level folks, at least in the states or in the jurisdictions, are aware that these changes are coming. Get in front of the governors, get in front of the EM leaders, get in front of the C-suite hospital folks, get in front of all of these people and let them know these changes are coming, so that they can go back home after a meeting and say, hey, what are we doing? And if your jurisdiction goes, oh, hey, we got this covered, then great. And if your jurisdiction doesn't, then that's your opportunity to start having those conversations of, well, here's what we need to get to that spot.
Yeah. That's helpful. Thanks, Peter. Peter, Gabby, thank you for taking time out of your day. Thank you for preparing this. Thank you for having conversations offline with folks at ASPR and SNS and doing the research. Sticking through this for over a decade, each of you, to be able to apply some of that knowledge now. We need it more than ever. I appreciate you going through the ASPO project and pulling that into it. Really grateful that you guys get to spend some time with us. This is evolving so quickly, so maybe we'll do a follow-up at some point. Maybe it's months from now, maybe it's tonight, as fast as this evolves. Ethan, I know we got requests about 3 or 4 people that are asking for like practical tips or things they can do. I think the huge impact stuff is stuff that Gabby and Peter talked about, especially when it comes to funding streams and mechanisms. You can't do anything without that unless you have that solid footing. Do you want to touch on any of that, or would you rather email that out to folks?
Yeah, no, I'd happy to go into a more granular level on the logistics side. I think, as Drew said, those engagement things that Gabby and Peter talked about are going to be the things that the fundamental and foundation building blocks to get anything done. When we've had lots of conversations post COVID for the last 4 years, there's been some themes that have popped up, and honestly, I don't think it's going to be anything new. I've seen most of these recommendations in the chat already. Things like, how do we count stuff? Are we counting in eaches? Are we counting by SKUs? Are we counting by packaging? The goal here is really like, what can we do on a local level or within our control to increase interoperability? Because the one thing I'm noticing in a lot of these conversations is we don't know what the end state will be, but it will likely be a lot more responsibility on jurisdictions, on states to fill that gap. Where there's been barriers in the past is you can't create any sort of coalition if the data can't talk to each other. and we're on these little islands, these little data islands. And even though we're in two counties next to each other, we'll never be able to support each other because we don't have any sort of interoperability. And there were three areas that kind of came to my mind as I was thinking about this. One is counts. If we were transitioning counts to something universal like eaches, makes it a lot easier than saying, well, are you sending me boxes? Are you sending me pallets? Are you sending me gallons? What's that measurement? The second thing is category naming. Somebody, I think Stephanie, maybe you had put this in the chat. You've been asking for some sort of resource typing standardization from the SNS and ASPR for a while. That, in my mind, is probably one of the most significant things that could be done that would allow systems to talk to each other. So what Peter and Gabby were doing with the H-core data stuff, very much being able to allow that data to talk to each other. And then the last part is continuity. And that's a kind of broad bucket for me, but specifically switching more to a burn rate style system. So moving off of PARs. PARs are great for planning, but understanding what you have on hand and how quickly it's being used allows you to support other people if you're looking to do a regional compact. So burn rates, real-time data, and multi-site integration. You have to have real-time, robust data that's validated across your entire response. I've got some visualizations that we'll send this out to everybody of how this all sort of plays out. But ultimately, these are some really small changes that we have control over that have huge impacts. So I know when I was supporting a state, when they made just these simple 3 changes, it saved $1.6 million over 2 quarters. It increased accuracy from like 28% in a warehouse to 98%. Fulfillment rates jumped from 33% to 88%. There's a lot of good, I think, knock-on effects. And these are things that we can do that you don't have to necessarily wait. It's any system can make these adjustments. So I'll share that stuff with whoever wants it. But just at a really high level, it's that interoperability piece that I think is really going to allow any sort of regional compact, local compact, information sharing within a state, outside a state. That's a fundamental building block.
Thanks, Ethan. Yeah, we'll send that out. There's some stuff in there, how to even group your data and set up your cache, your FMS, any of that by response. Yeah, Tyler, send that map my way. I'm curious, has anybody else seen this map of states stockpile mapping?
Yeah, I mentioned it. It was in the SNS,
Okay.
their listening sessions. They had sent out these surveys. The biggest problem with the data was that it wasn't always clear who actually answered those questions. So in some cases, a hospital might say, "Oh yeah, we stockpile."
Yeah.
And then suddenly that got marked down. Or like us, we answered, yes, we have a stockpile. We have an Ebola stockpile. We can treat, this handful of patients for 72 hours. And that was considered, oh, okay, you guys are stockpiling. It's like, well, that's not the same as we have this big, robust stockpile. We've got, this little area with some gowns and, peppers and stuff like that. But this is not like a massive stockpile where we can suddenly outfit the entire state for, 30 days kind of a thing.
Yeah, that's a hard one to do a survey and get, speaking this, even with best intentions of answering it, to get valid data. That's a tough one. But yeah, that'd be awesome if you could share, Tyler. Other notes here. Stephanie also said you can reach out to her for Florida, get some eyes in how they're doing their stockpiling. And Charlotte was interested. If you want to email California, she put her email in there too. If you want to share your states, how they're doing it, have a conversation with Charlotte and the team at CDPH. But that's a wrap for today. That's a lot of info at once. We have a couple other webinars coming up. We're going to do a demo on our LMS, talk about some of this pods and real-time burn rates, multi-site integration, interagency transfers, caches, consumables, assets, all the fun stuff. The updates that we've done is we launched this fall with a few agencies. Pretty excited about that. If you're interested in that, you can reach out to me. We can always do a different demo, but this will be a group one. And we'll also be doing one with Roberto Mugavero, who's in Italy. He gets funded by the European Union, and they've been working on how to do large scale mass casualty triaging. So, when you're talking about 3, 4, 5,000 folks, as he was explaining to me, you don't have time or have the resources to have triage tags. What can you use on you? So they're developing a process to use things that are on people, like lipstick, and getting your civilians involved in this just-in-time training for triaging. So that's what we got on the docket. That's it. Again, one more time, Peter, Gabby, thank you. Super grateful. Everyone on the call, thank you so much for what you do. It's really important. It means a lot. You do so much to prevent stuff that doesn't get seen and doesn't get celebrated, but everybody on here knows what you do. It's thankless often, and it's stressful when you don't know what's around the corner, which is the landscape we find ourselves in. So, thank you. It's more important than ever. So we'll be back, with those next webinars, and we'll talk then.
Thank you,
everyone.
Gabby. Thank you, Peter. Thank you for joining. One request, if you guys found this helpful, please feel free to ping us. Let us know if you can email us, or if this would be a helpful ongoing series. Please let us know. I don't know if we'll be lucky enough to rope Gabby and Peter back in. But that's helpful feedback for us to be able to plan some more webinars to kind of help push this forward. So everybody have a fantastic day. Gabby, Peter, thank you all for sharing your knowledge with us.